Welcome to MedTech Talk, where we explore the latest innovations in medical technology. Joining us today is Dr. Abhay Chopada, a distinguished colorectal surgeon and an influential thought leader in the fields of health and artificial intelligence. Welcome, Dr. Abhay.
Thank you for inviting me. It's a pleasure to be on your show.
So, for our viewers, Dr. Abhay is at the forefront of integrating advanced AI technologies to revolutionize patient care and healthcare practices. So, today we plan to discuss with him the importance of regular health checkups. So, something which is as simple as health checkups and what is the importance of these regular health checkups? That is going to be our topic for today. So, doctor, why are regular health checkups essential for overall health?
So the one word answer will be because you really want to live a healthy life. But let me explain an analogy. What happens is our body is designed to really work without much of a trouble till the age of 40. And that is because the human longevity till about 500 years ago was only about 40, 45 years. Right? So you hardly get any problem till then. But what happens is a lot of chronic diseases start setting in. Today, the longevity of a human being has gone up to the late 80s, which means you start slowly seeing problems once you are, typically once you're 50 plus. Now, I'll use a very simple analogy. Your car these days never fails on you, and the early versions of the cars used to all break down all the times. You have to push them. I don't remember ever needing to push my car because today, if there's even the slightest problem with my car, I get a yellow light on my dashboard. And then I will take it to a garage and I'll do regular servicing, I'll maintain my car so it never breaks down on me. But when it comes to human beings, I'm still absolutely depressed to hear about, oh, he was very well till yesterday. Then he had a heart attack and he died. Remember, no disease just happens suddenly. What it essentially means is that we are not monitoring the early warning signs, we are ignoring it. And we are letting ourselves go into a stage where suddenly the event will happen. Regular health checkups are your way of listening to those early signs, modifying your behavior, having early intervention. So it's not to check whether you're healthy, it's to check whether you're likely to develop any ill health in the future. And typically, most of the conditions don't have symptoms. They start early when you have no problem. You feel that you're okay. But that is the right time to figure out if any problem has started already. And
Right.
I will tell you, I'll give you a very classic example. People hear about heart attacks, and that is because the coronary arteries harden. Do you know what is the earliest age at which this process starts? The hardening of your coronaries can start as early as 18 years of age.
Wow.
Believe you me, that's very early. You will assume at 18 you're completely fit and well. Yes, because you don't have any symptoms. But it'll take several years for that coronary to keep slowly narrowing. And then one point when you have a clot that blocks the flow, you're suddenly going to get a heart attack and you're going to pass away. But you're only 40, 45. So it is absolutely vital that we don't take our body for granted and we should do regular health checkups.
Right. That was a lovely analogy, actually, comparing the servicing of cars and regular health checkups with our bodies. So, yes, I also believe that not all health problems are sudden, they all accumulate and then they present as a symptom, right?
Shall I
So,
correct you? No health problem is sudden. There is
right,
not a single health problem that happens suddenly. There are always a precursor condition or something that can potentially stop, whether it's a stroke, whether it's a heart attack. And the only exception to this rule is trauma. Yes,
right,
trauma is the only medical condition which I can't predict. And that's for purely because trauma is external. Anything
right.
that's related to external, I can't control. But anything that is an inherent body issue, I can stop it through regular checkups.
Right. Unless it's an accident or a traumatic incident, most of the health issues are something which have accumulated over a period of time and have been ignored by a lot of people. So, doctor, how is artificial intelligence transforming how we conduct and interpret regular health checkups? And what AI driven tools or technologies are up and coming in this area?
Very interesting question. I'm very glad that you brought it up. It's a topic really close to my heart, and I'll tell you why. Human beings, by their very nature, are lazy. It doesn't matter how much I tell people to have self assessment. They'll always be busy. Something else will always have a priority. Oh, I had this urgent presentation, so I really decided to postpone my checkup till next month. Next month and next month. Several years pass by. So the best way of doing regular checkups will be passive checks. So you don't actually do anything, but I still check you up. Now you'll say, how can you do that? And this is where AI comes in. So one of the earliest tools we developed at Axon Care is by looking at a person and checking, just by looking, not by touching, not by looking at a person and doing his heart rate, his blood pressure, his temperature, his respiratory rate. Now you might assume, ki, so what? And I'll tell you, so what? Listen, I can manage your trends. Let's assume your heart rate is slowly going from 70 to 75 to 80 to 90. Then I know something is wrong. Either your metabolic rate is going up, your thyroid function is abnormal, or you're very stressed. So this trending of what is essentially normal, but looking at the trend pattern can give me a lot of insights. It's not mature yet. But there are also people who are looking at doing blood glucose by looking at you, doing your ECG merely by looking at you. We also have tried those algorithms. They're very interesting and successful algorithms. But imagine if I can do your ECG and map your heart activity merely by looking at you. Then in future, your health checkup will happen every time you're on a railway station or you're passing a public space because the cameras will know who you are. They'll actually automatically assess your health condition. And if there's any alert, they'll straight away tell you, yo, we are seeing a problem, go and see a doctor. That sounds very, very futuristic. But believe you me, I don't think it's that futuristic. It's already there. That's one way of it. The second part is we actually can start integrating AI to assess your normal day work. So today you'd be surprised. Zoom is also integrating a lot of third-party AI tools. Google Meet is doing the same. Teams is doing the same. Why? Some of these tools will allow you to manage your own health. And I'll explain it to you how. Like I mentioned to you the earlier app, which can do everything by looking at it. The camera feed can be pushed to it. But
Right.
similarly, there are AI bots, which actually, there's a very interesting company out of Bangalore. I will not tell you the name, but what they do is they track your eye movement. And if you feel dizzy or giddy, your eye movement is good enough to tell whether it's an inner ear problem or whether you got a brain tumor. Now imagine this will start way before even you feel giddy. If I monitor your eye movements and I start seeing nystagmus that I previously wasn't expecting, especially if it's irregular nystagmus, I now can, I literally can send you a message to you to say, you know what, I'm getting a bit concerned about your eyeball movement. There's something irregular there. I want you to go and see a neurologist or XYZ, whatever it is. Similarly, emotional assessment is now possible through AI.
Okay.
So imagine you're on a meeting and I now know you're happy, or let's assume you're stressed. That again can be an intervention point. Now you might say, "Okay, but hang on, this is too, this is going to invade privacy." I completely agree. Yes, it will. But the capability of doing your complete assessment using AI is already there. And you'd be surprised that today we have sensors which previously we never had. You have your Samsung watch, your Apple watch, your Fitbit. They all are monitoring your health parameters. These health
Right.
parameters will be analyzed using AI, and they'll start picking up trends for your chronic diseases. So again, I'll tell you why I'm so interested. So we started a journey pre-Axonic as CliniVantage, where we built a whole platform to manage this data. We can completely see how the future is going to be AI driven. But in order to manage that data, you need platforms. You need to actually understand exactly what is relevant. And
Right.
Axonic healthcare platform actually is designed for that.
Wow. That sounds really interesting how AI is involved in the health scenario and suddenly the issue is not therapeutic, it becomes preventative.
No, so again, like I said, it actually at the moment the way you started is it can be used in both the areas. You can start in the therapeutic arena to help, and over a period of time, you'll have maintenance, which is what your regular health checkups are all about.
Great, great. So, can you share some common health issues often detected through routine checkups? How does AI improve the accuracy and speed of these diagnoses?
Let's split this into two parts. So, what are the common diseases that we currently pick up through regular health checkups? And I'll tell you, classically, it is aimed at picking early cardiovascular disease. It's aimed at picking up things like high blood pressure, high thyroid function, or emotional issues. Some people do routine checkup for cancer markers, and that's absolutely fine. And this is what we all call as surrogate markers. So when I check your blood pressure and it is high, it is a marker of a disease called atherosclerosis or narrowing of your blood vessels. If I do your stress test and I get an abnormal ECG, then I know probably I now need to do an angiography because this coronaries are small and you can get a heart attack. So we are currently are focusing only on the two or three major killers. The major killers are cardiovascular diseases, stroke, and cancer. So your routine health check is not really aimed at getting you fitter. It is merely aimed at checking what few things can we do to prevent the major killers.
Right.
Now let me come back to what AI is doing. AI is taking away your need to have this single point assessment. I go for a health check once a year. Now remember, there are 365 days, and even if I'm okay today, I might not be okay in 364 days from now.
Right.
We are taking the concept of regular checkups away from a single point assessment. And we are saying your health will be checked 24/7, 365 through your gadgets, as I told you, the smart watches. There are some very interesting devices that are coming, they're still in research stage, but where people assess your sweat. We all sweat, we just don't notice it. And they pick up biomarkers in your sweat to pick up whether your body is functioning well or not. Right?
Wow.
There are people who are doing biomarkers through urine and feces where they integrate with your toilet. Now, you might find it yucky, but believe you me, this is all data points to me. So, Japan has already introduced a smart toilet which can pick up bowel cancer. Right? So, imagine now, similarly, you can do similar things for urine. So, you can start doing your assessment almost on a daily basis.
Right.
And that's going to be a paradigm shift. I probably would envisage that to take another 10 years before that becomes routine because human inertia is unbelievably strong. Right? We are the most inertial of all the bodies, right? But it is getting integrated one little step at a time. So as I told you that I've already looked at a smart toilet in Japan, I was quite impressed with how they've gone about it. There are companies in London which are just analyzing your breath, and they can accurately diagnose your esophageal and gastric cancers just through your breath. So you can imagine we are full of smart people who are looking for little markers that can help manage your health.
Right.
These will all start converging at some stage. This convergence is what is going to allow you to monitor yourself not once a year, not once every 6 months, but literally minute after minute, so that we can prevent any long term damage. The whole idea here is if I want human beings to live for 300 years, which is what stem cell therapy and new anti aging therapies are trying to aim at, I need to manage diseases. There is no point in keeping someone alive and make him suffer for 200 years. If he has
Right.
to live to 300, he has to be healthy for 300 years.
Right.
That is what we, as from a completely different perspective, that's what I'm working on.
Right. Definitely. Health is quite a deciding factor in the quality of life which you live. And doctor, you briefly mentioned about Fitbits and wearable health devices in your conversation. So, what do you think? What kind of role do the wearable health devices play in the future of routine health assessments, especially with the AI integration in picture?
Quite a bit. So I'll tell you, you'll be very surprised that these devices are now slowly getting commonplace. Uh, there are a lot of people who have arrhythmia. It's called atrial fibrillation. It can actually potentially cause strokes or even heart attacks. So that as Apple Watch has saved at least a few lives because it alerted the patient that you got atrial fibrillation. And now similarly, let's assume as the sensors get more mature, I start getting accurate blood pressure readings or accurate, let's say, um, sweat monitoring or accurate other monitoring, what is going to happen is we're going to get more and more data points. I remember, as a human being, I only have five senses. We always say that, But do you know there are at least 60 different senses for human health? 60. And they come
Wow.
over for different reasons. So, today I've got a pressure monitor, I've got a vibration monitor, I've got a humidity monitor. You might say, but so what? And I'll tell you, so they are all important because they can add an extra layer for us to do the data analysis. Are they all integrated in smartwatches today? No. Smartwatch probably has three or four sensors. You'd be surprised. So a lot of smartwatches have an accelerometer in it. So if I fell down, it can alert. Now remember, falling down to me is quite a big event from human health perspective. If it's an
Right.
elderly man, he can break his hip. If it's a young man, it could be a sign of cardiac diseases. So monitoring simple events like that. Maybe you've not actually fallen down. Maybe you just lost your balance for a second. But during that 1 second of lost balance, what was my heart rate doing? What was my blood pressure doing? Was that vasovaggal or not? All these data points help me understand exactly what happened.
Right.
So you can stop someone from having sudden events. And I'll go to another extreme, something that actually I find very tragic to hear. Young athletes, especially young kids, suddenly die on the playground. And almost always that is because they have a small heart issue that makes their heart go very fast. And once your heart goes into fibrillation, you get a cardiac arrest. Right?
Right.
Is this monitorable and preventable? The answer is 100%. If I can see a young man whose heart rate is going to 160, 170, I'll make him stop. I absolutely can immediately make an alarm sound to say stop, otherwise there's a heart issue. So those kind of little things that we ignore because we are just not aware. We are not aware of what needs to happen. Those are the little things that wearables are definitely going to help us for the future. So your wearables immediately are effective. They'll get more and more effective with every passing month. And in the long term, they will actually stop a lot of your chronic problems.
Right. They also do monitor the sleep quality, which is also quite interesting from the perspective of how your recovery happens.
So let me explain it a different way. Look at your wearables merely as data generators,
Right.
and AI is your data analyzer. Now, you can give me data in any form. It could be your sleep pattern. In fact, there was a very interesting study out of MIT, and though they could interpret dreams. So what they did was before you went to sleep, they showed you 20 pictures, and they did an MRI throughout your night. And the MRI, if you had a dream where you saw that picture, your MRI pattern actually could decipher. He dreamt about this picture. And in the morning when you woke up, they asked, okay, did you see this in your dream? And if the answer was yes, 9 out of 10 times, no, not nine, 7 out of 10 times they were accurate. Can you imagine? So we are slowly moving towards a world where even your functional MRIs will tell what you're thinking or what you're seeing inside your brain. Very
Right.
interesting times. Very interesting times.
Definitely, with wearables, if they can monitor the REM sleep which you're getting, it is going to be a game changer. So,
That already exists. Monitoring your REM sleep is already there are plenty of devices. There are rings which monitor your sleep quality.
yeah,
Sleep has already been pretty well exploited from a data sciences perspective.
right. So, what unique AI driven services or features does Axon Care offer to supportive preventive healthcare?
So, as I said, we are taking a very practical approach. Today, the first thing we want to do is empower our doctors to be much more effective. And we want to slowly actually offer wearables and devices to our patients so they can monitor their health condition without having to go to the doctor. So our health ATM is it's just an accumulation of a lot of the devices that actually I can offer to the patient individually, right?
Right.
So the second thing is we've already started working into, as I told you, I can do vital signs by merely looking at you. Over the next few months, we will give you an ECG by looking at you. You'll say, hang on, how is that even possible? The answer is yes, it's possible. We just have to put our heart in and get it done, right? So there is a lot of that potential is possible. We see our journey as just the beginning. It's merely the beginning. There's plenty we can do.
Right. In your experience, how do AI and regular checkups contribute to preventive healthcare and reducing long term medical costs?
Too early to understand that. Whether we're going to over medicalize the world or we're going to under medicalize it, it's too early. AI has really been at the forefront over the last 12 months, and a lot of AI integrations for healthcare again are fairly recent. So it is the jury's still out there. I am reasonably certain intuitively that it can cut down the healthcare cost quite significantly, because any problem picked up early is much easier to resolve.
Right.
But given the way healthcare industry functions, I'll still hold on my horses about the real cost, because we potentially can say, okay, but we picked up a problem that was going to have no consequences and treated it. That is also a realistic possibility. So the jury's still out there. I would conclude by saying that, listen, AI is very exciting, very interesting, but there's still a very long way to go, especially because doctors have to be empowered first to transform healthcare.
Right. So that pretty much covers everything we wanted to know about AI and what role it will play in regular health checkups. So thank you so much, Doctor, for your valuable time. It was a very engaging and enlightening conversation for us.
Thank you. It was my pleasure.
Yes. And for our viewers, what's the biggest game changer in medical technology you've seen this year? You can share your thoughts in the comment box. Thank you. See you again.